Are migraines disrupting your life and leaving you desperate for relief? Look no further than Imitrex, a medication specifically formulated to alleviate the debilitating pain and symptoms associated with migraines. In this video, we delve into everything you need to know about Imitrex, from dosage recommendations to its myriad of benefits and potential side effects. Imitrex is a popular prescription medicine that works by narrowing blood vessels in the brain to reduce the throbbing pain and accompanying symptoms of migraines. It provides rapid relief, allowing sufferers to resume their daily activities without being held hostage by the intense pain and sensitivity to light and sound. Understanding the proper dosage of Imitrex is crucial to ensuring its effectiveness and minimizing potential side effects. Moreover, gaining insight into the numerous benefits and precautions associated with this medication is essential for making informed decisions about your migraine treatment. In this comprehensive guide, we will explore the recommended Imitrex dosage, its potential benefits, and the possible side effects you should be aware of. Discover how Imitrex can provide much-needed relief and improve your quality of life in the fight against migraines. What is Imitrex and how does it work? Imitrex, also known by its generic name Sumatriptan, is a medication used to relieve the symptoms of migraines. It belongs to a class of drugs called selective serotonin receptor agonists, which work by stimulating certain receptors in the brain to reduce inflammation and constrict blood vessels. By narrowing the blood vessels in the brain, Imitrex helps to alleviate the throbbing pain, sensitivity to light and sound, and other debilitating symptoms that often accompany migraines. The effectiveness of Imitrex in relieving migraines is attributed to its ability to target specific receptors in the brain and reduce the release of certain chemicals that contribute to migraine attacks. It is available in various forms, including oral tablets, nasal spray, and injectable solutions, allowing for flexibility in administration based on the severity of the migraine and personal preference. It is important to note that Imitrex is not a preventative medication and should only be used to treat acute migraine episodes. If you experience frequent or chronic migraines, it is recommended to consult with your healthcare provider to explore preventive treatment options. Understanding migraines and their symptoms. Migraines are severe headaches characterized by intense, throbbing pain, usually on one side of the head. They can last for hours or even days, significantly impacting the sufferer's quality of life. In addition to the excruciating pain, migraines are often accompanied by other symptoms, including nausea, vomiting, sensitivity to light and sound, and visual disturbances. The exact cause of migraines is not fully understood, but they are believed to be influenced by a combination of genetic and environmental factors. Certain triggers, such as stress, hormonal changes, certain foods or drinks, lack of sleep, and sensory stimuli, can precipitate migraine attacks in susceptible individuals. Understanding your individual triggers can be helpful in managing and preventing migraine episodes. Migraines can be classified into two main types: migraines with aura and migraines without aura. Aura refers to a set of symptoms that precede or accompany a migraine attack, typically involving visual disturbances, such as flashing lights or zigzag lines. Not all migraine sufferers experience aura, and the absence of aura does not make the migraine any less severe. The benefits of using Imitrex for migraines. Imitrex offers several benefits for those suffering from migraines. One of the primary advantages is its ability to provide rapid relief from the debilitating symptoms. When taken at the onset of a migraine attack, Imitrex can significantly reduce the severity and duration of the headache, allowing individuals to resume their regular activities more quickly. Another benefit of Imitrex is its versatility in terms of administration options. The availability of oral tablets, nasal sprays, and injectable solutions allows patients to choose the most convenient and effective method for their specific needs. Oral tablets are suitable for those who prefer a simple and discreet option, while nasal sprays and injectable solutions offer faster absorption and may be more effective for individuals experiencing severe nausea or vomiting during a migraine attack. Additionally, Imitrex has been shown to be effective in relieving not only the pain associated with migraines but also other symptoms such as nausea, vomiting, and sensitivity to light and sound. This comprehensive relief can greatly enhance the quality of life for migraine sufferers, allowing them to regain control and function more effectively during and after an attack. While Imitrex provides significant benefits, it is important to note that individual responses to the medication may vary. Some individuals may find complete relief from their migraines, while others may experience only partial relief or no relief at all. It is recommended to work closely with your healthcare provider to determine the most effective treatment plan for your specific condition. Dosage guidelines for Imitrex. The dosage of Imitrex prescribed will depend on various factors, including the severity of your migraines, your response to the medication, and the form of Imitrex being used. It is important to follow your healthcare provider's instructions and not exceed the recommended dose. For oral tablets, the typical starting dose of Imitrex is 25 mg. If the migraine symptoms persist or return after initial relief, a second dose can be taken at least 2 hours after the first dose. The maximum recommended daily dose for oral tablets is 200 mg. For nasal spray, the recommended dose is 5 mg or 10 mg per nostril. The total daily dose should not exceed 40 mg. It is important to follow the specific instructions provided with the nasal spray device to ensure accurate dosing. Injectable solutions of Imitrex are available in pre-filled syringes or auto-injectors. The recommended starting dose for injectable solutions is 4 mg administered subcutaneously. If the migraine symptoms persist or return, a second dose can be given at least 1 hour after the first dose. The maximum recommended daily dose for injectable solutions is 12 mg. It is worth noting that Imitrex should not be used more frequently than prescribed, as excessive use can lead to medication overuse headaches, also known as rebound headaches. If you find that you need to use Imitrex frequently, it is advisable to consult with your healthcare provider to reassess your treatment plan. Common side effects of Imitrex. Like any medication, Imitrex can cause side effects, although not everyone will experience them. The most common side effects of Imitrex include injection site reactions. Some individuals may experience discomfort, redness, or swelling at the injection site when using the injectable form of Imitrex. These reactions are usually mild and transient. Nausea and vomiting. Imitrex can cause gastrointestinal disturbances, including nausea and vomiting. Taking the medication with food or using anti-nausea medication can help alleviate these side effects. Dizziness and drowsiness. Imitrex may cause dizziness or drowsiness in some individuals. It is important to avoid activities that require alertness, such as driving or operating machinery, until you know how the medication affects you. Sensations of tingling or warmth. Some individuals may experience sensations of tingling or warmth, often in the face or extremities, after taking Imitrex. These sensations are usually mild and transient. Chest discomfort. In rare cases, Imitrex may cause chest discomfort or tightness. If you experience any chest pain or discomfort, it is important to seek immediate medical attention. It is essential to discuss any side effects you experience with your healthcare provider. They can provide guidance on managing these side effects or adjust the dosage or form of Imitrex to minimize their occurrence. Precautions and warnings when using Imitrex. Imitrex is generally safe and well tolerated, but there are certain precautions and warnings to be aware of when using this medication. Cardiovascular risks. Imitrex can cause narrowing of blood vessels, including those in the heart. Individuals with a history of heart disease, high blood pressure, or certain other cardiovascular conditions may be at an increased risk of experiencing serious cardiovascular events when using Imitrex. It is important to discuss your medical history with your healthcare provider before starting Imitrex. Medication interactions. Imitrex can interact with certain medications, including monoamine oxidase inhibitors, MAOIs, selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. These interactions can increase the risk of serotonin syndrome, a potentially life-threatening condition. It is important to inform your healthcare provider about all the medications you are currently taking to avoid potential interactions. Allergic reactions. Some individuals may have an allergic reaction to Imitrex, characterized by symptoms such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. If you experience any signs of an allergic reaction, seek immediate medical attention. Pregnancy and breastfeeding. The safety of Imitrex during pregnancy and breastfeeding has not been established. It is important to discuss the potential risks and benefits with your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. It is crucial to follow your healthcare provider's instructions and disclose your complete medical history and current medications to ensure the safe and effective use of Imitrex. Alternative treatment options for migraines. While Imitrex can be highly effective in treating migraines, it may not be suitable for everyone or may not provide complete relief in all cases. Fortunately, there are alternative treatment options available for managing migraines. These options include over-the-counter pain relievers. Non-prescription pain relievers such as acetaminophen, ibuprofen, or naproxen sodium can be effective in relieving mild to moderate migraines. It is important to follow the recommended dosages and precautions when using these medications. Triptans. Triptans are a class of medications similar to Imitrex that can be used to treat migraines. They work by constricting blood vessels and reducing inflammation in the brain. Triptans are available in various forms, including oral tablets, nasal sprays, and injectable solutions. Preventive medications. If you experience frequent or chronic migraines, your healthcare provider may recommend preventive medications to reduce the frequency and severity of your migraine attacks. These medications can include beta blockers, antidepressants, anticonvulsants, or Botox injections. Lifestyle modifications. Certain lifestyle changes can help manage migraines. These include identifying and avoiding trigger factors, practicing stress management techniques, maintaining a regular sleep schedule, staying hydrated, and engaging in regular exercise. It is important to consult with your healthcare provider to determine the most appropriate treatment plan for your specific condition. They can help assess your individual needs and guide you in selecting the most effective options for managing your migraines. Frequently asked questions about Imitrex. Can I take Imitrex for all types of headaches? Imitrex is specifically indicated for the treatment of migraines and should not be used for other types of headaches unless directed by your healthcare provider. Can I take Imitrex if I am pregnant or breastfeeding? The safety of Imitrex during pregnancy and breastfeeding has not been established. It is important to discuss the potential risks and benefits with your healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. Can I take Imitrex with other medications? Imitrex can interact with certain medications, including MAOIs, SSRIs, and SNRIs. It is important to inform your healthcare provider about all the medications you are currently taking to avoid potential interactions. Can I drive or operate machinery after taking Imitrex? Imitrex may cause dizziness or drowsiness in some individuals. It is important to avoid activities that require alertness until you know how the medication affects you. Can I use Imitrex as a preventive medication? Imitrex is not a preventive medication and should only be used to treat acute migraine episodes. If you experience frequent or chronic migraines, it is recommended to consult with your healthcare provider to explore preventive treatment options. Real-life experiences with using Imitrex for migraines. Here are a few real-life experiences shared by individuals who have used Imitrex for migraines. Emily. Imitrex has been a game-changer for me. I used to suffer from debilitating migraines that would last for days, but now I can take Imitrex at the first sign of an attack and get relief within an hour. It has truly improved my quality of life. David. I was skeptical about using medication for my migraines, but I reached a point where I couldn't function anymore. I tried Imitrex, and it has been a lifesaver. I still get migraines occasionally, but Imitrex helps me manage them much better. Sarah. Imitrex didn't work for me initially, but my doctor adjusted the dosage, and now it provides significant relief. It took some trial and error to find the right dose, but I'm grateful for the improvement it has brought to my life. It is important to remember that individual experiences with medication can vary. What works for one person may not work for another, and it may take some time to find the most effective treatment plan for your migraines. Open communication with your healthcare provider is key in determining the best course of action for your specific needs. Conclusion. Is Imitrex the right choice for managing your migraines? Imitrex, with its ability to provide rapid relief from the excruciating pain and other symptoms of migraines, has proven to be an effective treatment option for many individuals. Its versatility in administration options and comprehensive relief make it a popular choice among migraine sufferers. However, it is important to approach the use of Imitrex with caution and follow your healthcare provider's instructions. Understanding the proper dosage, potential benefits, and possible side effects is crucial in making informed decisions about your migraine treatment. If you are seeking relief from migraines and have not yet explored the use of Imitrex, it may be worth discussing this option with your healthcare provider. They can assess your individual needs and guide you in determining if Imitrex is the right choice for managing your migraines. Thanks for watching.